morning, doctor.
Hi, good morning. Today we're going to talk about a case of a patient that has severe circulation clotting. Here's the picture of the patient's eyes, and
Okay.
this is the very characteristic picture of a patient that with severe blood circulation blockage. Okay,
Let's see what is the
so
picture.
the featuring blood vessel in the eye is right here. So you see the very exaggerated, squiggly line originating in the corner. So when you see a blood vessel twisted like this, you know that the circulation is not going well. So they have to strive to walk over the travel the blood vessel, so it ends up a route like this,
Okay.
right? So if the blood vessel is the traffic is through, is smooth and through, then it should be just a straight line, or
Okay.
there's no line.
There
Yeah,
should be no line.
yeah, there should be no line, or it should be a straight line. But if the traffic is really jammed up, you can see that
Squiggly.
the twisted and turn, a lot of drama along the way, right? So
Okay.
that's how the squiggly line come into being. So what symptom does the patient has? The patient has a lot of symptoms. First of all, the patient is really impatient. He said that he's losing patience lately. So easily snap, right?
Okay.
So you can see a patient that has always throw a tantrum, has a short temper.
Okay.
You could suspect that something going on with the blood circulation. Uh,
That's why.
yeah, it could be
Okay.
very likely. And sleeping not good.
Okay.
Sleeping for people with circulation problem, they're not sleeping good. That's for sure.
Okay.
And he also have a varicose vein in the leg.
You mean cold
Ver-
limbs?
No, a varicose vein. Varicose
Oh.
vein. The vein bulged out in the leg.
Okay.
So
Oh.
yeah, and usually the regular doctor would ask to offer a surgery to fix that.
A cosmetic surgery.
Things like that. Yeah, but
Okay.
that doesn't any good. It only just like a band-aid surgery. It doesn't cure the root problem.
Okay.
Right. It's more than just cosmetic. It's about the blood circulation. Okay.
I see. Okay.
Constipation. The patient also would have constipation when the blood circulation is not going well. Patient will have constipation.
Okay.
And snoring heavy. That's very understandable. If you have a poor circulation, you're gonna have a chest tightness.
Mm-hmm.
Your heart, your cardiovascular are gonna have some trouble, so you're gonna snore very heavy,
Okay.
and you have a very dry skin, dry, peeling skin, flaky skin.
Okay.
Yeah. So when you have this ugly, like crocodile skin, those are the signs that you have a circulation and blockage. Yeah.
Oh.
And occasionally you have palpitation because that affects your cardiovascular travel, the blockage. And another thing is the patient going to have all kind of body pain. For example, I ask the patient, do you have shoulder pain? You have a neck, cervical pain? And it turns out he has very severe joint pain.
Joint pain.
Both joints.
Shoulder?
Both.
Okay.
Yeah, both shoulder joint pain.
Okay.
And also, patient like this would most likely would have a hemorrhoid, right?
Okay.
Patient may not tell you, but if you ask them, most of them going to have some hemorrhoid problem. Hemorrhoid is actually a symptom of circulation blockage too, right? It's a blood vessel get clogged up in the anus.
Okay.
So here's what happened. Here's the very featuring eye sign of patient with the circulation problem.
Okay.
We have a perfect solution to it.
Okay.
Yeah. For
Are
example,
there any other wings show up in any other area?
nothing more featuring like than this.
Okay.
Yeah.
Okay.
Nothing more telling than this one.
Okay.
So we have a perfect solution to it. We have a perfect recipe
Okay.
that consisted of cinnamon, peony flower, poria, apricot seed, alisma, things like that, to nicely address condition like this.
Oh,
Okay.
So there is a recipe for it.
Yep. Yeah. It's a classic recipe.
Okay.
Yeah.
Okay. Let's see what happened when you come back.
Okay. Good. That's all for today. Thank you.
Thank you.